A new study has discovered that adopting a gluten-free, or low-gluten diet can enhance your risk of developing type 2 diabetes. The principal study from Harvard University, which was presented yesterday at a meeting of the American Heart Association in Portland, reviewed 30 years really worth of medical statistics from 200,000 contributors, and found that people who limited their gluten consumption or avoided it actually had a 13% higher chance of developing type 2 diabetes. Gluten is a protein found in wheat, rye, barley, and other related grains. It is the protein that offers baked goods that chewy texture and elasticity in the baking procedure. People who are actually intolerant of an autoimmune condition called celiac disease, wherein their immune system responds to the gluten protein through attacking the small intestine. Only about 1% of the population is diagnosed as celiacs. Researchers used data from the Nurses' Health Study, where 199,794 people answered food-related questions every 2 to 4 years. They found participants consumed on average around 6-7 grams of gluten a day. Over the 30-year follow-up period, 15,942 cases of type 2 diabetes have been diagnosed. The study found that people who had a higher consumption of gluten, as much as 12 grams a day, were less possibly to increase type 2 diabetes. People who ate less gluten also had a lower cereal fiber intake. Fiber is known to defend against type 2 diabetes. When they had adjusted for the protective impact of fiber, they found those in the top 20% for consuming gluten had a 13% much less chance of developing type 2 diabetes, in comparison to those who consumed 4 grams or less. Zhong said, people without celiac disease may also reconsider restricting their gluten consumption for chronic disease prevention, particularly for diabetes, regardless of there being no showed evidence that adopting a gluten-free diet has any health advantages. It seems that people would still alternatively follow the advice of health bloggers or clean eating authorities, as the gluten-free meals trend is still on the rise. But, if you assume you may have an intolerance, then go to your medical doctor or a dietitian and get tested right now. Self-analysis of gluten sensitivity and the resulting elimination of gluten from your diet can be potentially harmful to undiagnosed celiacs. The best way to test for the intolerance is through studying diet, which medical doctors can't do if you've already eliminated gluten from it. Also, without proper analysis, undiagnosed celiacs are less probably to stick to the strict diet they want, risking their health, harm to their intestine, and growing their risk of some types of cancer.